Hello, friends, and welcome to another episode of the Concussion Nerds podcast. And we are back to guest episodes this week. And this week we are joined by my friend Darryl Yardley. Darryl, welcome.
Thanks. Nice to see you, Natasha, and thanks for the invite.
You're very welcome. Thanks for being here. Darryl is going to be another speaker on the upcoming Concussion Nerds podcast. So he's going to be speaking to the clinician. Particularly, I looped him in and convinced him to be part of this. I'm kidding. He loves giving back to this community because of his expertise, both as a physical therapist, but also as a mentor in the clinical space, as a clinic owner, and all the things and the knowledge that he brings to our profession as physical therapists. So I'm so stoked that you're part of this summit. Thank you for bringing your wealth of knowledge.
I'm excited too, just as an FYI. It's going to be super fun. I love
Perfect.
sort of seeing the community you built, and this type of work needs to be done. And I wish it was around in 2008 when I started.
So true. Oh my goodness. Darryl and I have this tendency to jump on calls and have a topic or film a podcast, and then we just talk and we're like, oh shit, we forgot to hit record. So before I yammer, Darryl, can you introduce yourself in more detail to this group, who you are, and more about who you are?
Yeah, sure. So, well, you already did a good job on the intro. So, but yeah, no, I'm Darryl Yardley. I'm a PT. That was honestly my professional training, but that sort of evolved into clinic ownership, mentor, coaching. We actually, from my days of being in the corporation and working as staff PT for PT Health back in the day to running a national development program and teaching at the university, that quickly turned us into when we created Clinic Accelerator and Mentorship Bootcamp. So right now we actually coach over 600 clinic owners and over 1,000 clinicians. And obviously I think a lot of times it's like, oh, this is all businessy, and it's not. Like, there certainly is a healthcare business that we all have to function and operate in. But at the end of the day, there's a whole community of patients that we currently serve, and there's a whole bunch that we don't serve, and we don't serve well enough. So that's really been a big focus of ours, is to help people become even more successful in practice and in business. And I've just been very fortunate too, I think, in my career, working with a lot of interdisciplinary models, I would say. So we do actually a lot of research as well, both in the public health space and with a lot of orthopedic surgeons. So we actually just published last week, which is pretty cool. On just, again,
Congratulations.
Oh, thanks. And it's just interesting to see the power, what happens when you put PT with another profession. Right. And it's really interesting because a lot of medicine is so reliant on us as primary care providers. So it's sort of a piece that still keeps me energized in our clinical space, even though I think some people don't see me practice as much as I used to. But I still consider myself a PT. I still do consults once a week in clinics. So kind of certainly wear multiple hats, but I love it. And it keeps me excited and engaged. And that's why I'm so impressed with what you've built, because this is a totally underserviced demographic that we could do so better. And I would say we can do it even better, because I think there's a lot of people out there that do good stuff. I just think as evidence evolves, we can do even better.
Awesome. Thank you. So good. This is what's going to happen today, guys. So for the summit, I'm going to share what Darryl's coming to talk to the summit about, and then we're probably not going to talk about it at all on this podcast. So if you want to hear more about his summit topic, jump below to the show notes already. If you haven't already registered, jump in, register for the clinician track if you are a clinician, and you will get Darryl's topic, which, again, I brought him in, super knowledgeable PT in clinical care. I very, by choice, brought him in to talk about business, because I think as physical therapists in this space, whether you are an independent contractor or whether you are a clinic owner, you still have a business. And we have a job to do to be getting our services out to the world so that people know who you are. Because you might do really awesome work. Now, granted, Darryl and I have had this conversation. If you do really great work, word's going to get out on who you are. But you still need to get the word out, and the public needs to know who you are. So Darryl's topic for the summit is looking at revenue generating strategies for a niche brick and mortar clinic. So we're going to be focusing on more the traditional approach to rehab and in-clinic space, because we do have another expert coming to talk about more the hybrid and the virtual space. So I'm really going to watch your talk too, because I always like to learn from my colleagues as well and things that I can do. Do you want to give like a little snippet? Give a little snippet on what they're going to learn from you in the summit.
Yeah, sure. I'll agree with you. I'm not going to share a lot because you should be at this. So if you're clinical or a business owner, you need to come to this session because whether you're excited to be in that particular niche in and of itself, great. But there's so many transferable skills you're going to pick up from just being a participant in this summit. A couple of things though that we are going to show too, Natasha, is I think oftentimes when I think about PT and chiro and massage and a lot of our, what I think is such a growing part of our practice around counseling and the
Mhm.
psychosocial contributing
Oh,
factors to
we're going to talk about that on this
patient.
podcast.
Okay, good. For me, it's about what's within your control because you can't just say, I want to help people, right? Which is great because it's clearly why you went into your program. But you need to help more people know what you do. And if no one knows what you do, then you're just relying on maybe people walking in. But guess what? That reduced following the pandemic. People just don't walk in anymore and be like, hey, do you guys do same day appointments, right? Or we're also too freaking busy to have people just walk in. So how
Yeah.
do you prioritize cases? Like, so you'll hear lots of people say, well, there's only a certain patient population I want to see. Great. Does anybody know that's what you want to do? So we'll talk about a lot of strategies of how to help you control your niche practice sort of within the day-to-day work that you can do. So
I love
things
it.
that you could do what I call in-house, sort of interacting with patients. So owner, what can you do to support your staff? So you're a contractor, you're an employee, doesn't matter. What are things that are in our control as primary care providers? And the second part that we'll look at though is what are some of the things that you could outsource potentially so you can dedicate more of your time doing the things that you love and you're really good at. And if you're really good at them and you do them well, you should have that additional revenue that could supplement outsourcing things that you don't to do it. Right.
Mhm.
So, and I think that's also sometimes a driver of what we consider work life integration. There's lots of things that end up filling my time that I don't love
Yeah.
versus what I do love to do. So that just shifting that balance there would totally change my work life integration. Right. So
And
that's what we're going to talk.
I love it. And what's even just listening to you talk, the whole thing about like, do people know that's what you want to do? So it's
Yeah.
so funny because obviously people know I treat concussion. That's
Mhm.
known.
Yeah.
Right. And people know that my clinic specializes in concussion. That's known. But it's so funny that you say that because I literally just had a conversation with another clinic group on the island this week. Because a
Mhm.
piece of what I really want Symphony to be is a supportive place for other clinics, ultimately on the island, and BC is the easiest because we have all this technology to help really, when I talk about that integrative multi systems assessment, to get a deep look at what's going on with our client, to then be able to take that and support another clinician. So another clinic doesn't necessarily need to go buy the hundreds of thousands of dollars of technology, but their client could come to Symphony as a
Mhm.
partner or as just a collaborative colleague. And we can put the detailed assessment, put together a report like a consult, and then
Yeah.
go back to the treating therapist and say, here's what we found. This would be our recommendation for the treatment plan. This is likely a piece that's holding this person back. Like, here's the piece you can't see with naked eyes at bedside.
Mhm.
And so I had this discussion with this clinic group and the owner of this clinic group. And I was like, here's how Symphony can support you so that you can see those persistent clients, but they can come here. We can do this consultative assessment to support your team. And we talked to them about actually being a concussion nerds clinic as a
Mhm.
whole and what that could look
Yeah.
like too in terms of mentorship. But again, you just saying that, like, I have to vocalize that to other clinic owners if I
Mhm.
want that to happen. I can't
Yeah.
just sit there and wait for it to fall in my lap.
That's right. And I think if you look over the years too, with a lot of owners, it's like, oh, we had somebody that was like really interested in service X or, really working
Mhm.
with condition Y. And the problem is that they either maybe they go on mat leave and all of a sudden, poof, that service is gone. Or that person relocates and you have this
Yeah.
investment. And then oftentimes it's a big investment. I remember when we had you in our podcast, it's like, hey, what's the minimum requirements you need to, not just say you do concussion on your website. Like, let's be real. Like, how do you offer a service that isn't just like a list of things on some shitty website, right? Like, do you really do this and you do it well? Then what
Mhm.
is your access point? So similar to you, like, people look at me and you're like, well, you're the hip guy. Like, yeah. And here's what I will tell you. I will only refer patients out of my practice because I don't see people. So I transfer care and I see them from all over the province to people that are willing to communicate.
Yeah.
And it blows my mind how many clinicians do not want to collaborate. And I don't even charge you, right?
Yeah.
Like,
It's
I
mind
just need you
boggling.
to treat this hip scope properly. And we only really see probably less than 50 bilateral scopes a year, which means you've never seen a bilateral hip scope before. I've never seen some of the stuff that you've seen. So I need that guidance and support, but
Mhm.
I'm not interested in taking that patient. I don't
Yeah.
have time, but I don't see why they shouldn't get the full expertise from PT, but also just like what you've done is I'm happy to send them back. And it's not a pissing contest.
No.
And I've never had a patient that I referred out for another, like a higher level of expertise than I say, I have a contact that I send to for a running assessment who has all this like cool gizmo stuff. And guess what? He's even a chiro. And I refer to him because he's that friggin' good. But
Yeah.
the interesting thing is the last patient that I did refer, she's 18 years into practice. She was the first one that called me. Hey, I have your patient coming tomorrow. What do you recommend that I? I'm like, why does it take someone who's been practicing that long to actually reach out? Whereas all the others, they do.
Well, and I still feel like there's this old, and I say old because it's not necessary, of like the competition. Why are we in competition with each other as
Mhm.
opposed to supporting each other and collaborating and working together? Like, even in the concussion space, there's, depending on what stats are all old, but 600,000 concussions a year in Canada. That's reported in the emergency department. So, there's actually
Mhm.
more than probably like a million concussions in Canada. There is plenty of people for everyone to have booming practices, to have the support, and we can still work together. There's no need for this, like, that's a competitive clinic, so I can't refer out there. Like, I don't understand where this mindset comes from. And it's in all the professions, but it's just such a disservice to ourselves and to our
Mhm.
patients.
Yeah. And when you give people the information, like I could say to somebody, hey, you know what? I have a really, like when my business partner's been on mat leave, and she's the pelvic health PT that I use to see a lot of these patients, like my hip patients. I'm like,
Mhm.
you know what? This is where I would actually send you. However, this is who I think, given where you want to be a marathon runner. I'd actually send you to Huntsville and actually do a consult there. Are you open to doing like that? Is 3 hours a week?
Mhm.
No problem. Yep, I will
Yeah,
do. And that guy ran a marathon and it was a male. Like, so
I
men
love
do
it.
need pelvic health.
Men need pelvic health for sure.
Yeah. It also helps increase their compliance with home exercise programs when you say, hey, if you don't do this, I'm going to send you to the pelvic health PT. Then all of a sudden they're like, I'll do whatever you say. And that guy actually went in Olympics. So,
Oh, that's
but what,
funny.
but what's another kind of interesting thing too is that you can't really be the jack of all trades either.
No.
So there's, another case that I saw on PT. And I love these assessments when they come in, they're like, what can you do for me? Seeing a whole bunch of clinics. I'm like, oh, you
Mhm.
tell me. And they're like, I thought you were the expert. I'm like, yeah, but you've seen a whole bunch of people. Like, so what can I help you with? And everybody else's discharge just said, don't do stuff. And I'm like, no, that doesn't make any sense. But here's the cool part too, is I have a colleague of mine, same thing. He's not a PT, so he doesn't have a billing number. And I'm like, look, I want you to get this performance testing and I want it to be done by this gentleman. And it's going to cost you $100. Are you cool with that? And then it's going to help me be that much more, specific to your program. He
Mhm.
did it within 48 hours. And
Yeah.
I was like, now I have something to work with. Now the clinician that's actually going to treat this guy has something to work from. He also can get reassessed in 6 weeks. Same thing with what you're saying, right? You have access to quantitative information, not just qualitative,
Mhm.
right? And I think,
Yeah.
with everything that we've seen, what you guys are experiencing in BC with Pacific Blue Cross and all this insurance stuff, we're going to have to start justifying and quantifying our treatment. And we're not good at it.
No, we're not.
I mean, and we're really good at treating, but we're not good enough at telling people in an understandable way why we're recommending what we do. Then we need to get better at it.
For sure. I'm gonna switch topics. I'm gonna change our gear
Yeah,
for a second. So I
sure.
realized I did like a story a while ago, and I realized I was doing, I think, therapists a bit of a disservice when I was saying, like, if you're a passionate clinician who wants to learn more about concussion, when I like had this like knock moment over the head of, I didn't go into PT because I was passionate about PT. And I didn't start treating concussion because I was passionate about concussion. it fell in my lap and the passion grew because I had a skill
Mm,
set that then let me see epic change in people's lives. And then there was other reasons. Now I'm insanely passionate about it. Like you can hear it in my
mhm,
voice. So there's so many new PTs coming into the space and, I've interviewed a few of them. Yeah, you interview them all the time.
mhm.
And they're all struggling with like, do I niche down right away? Like, I don't know what my passion is. Like, so two questions would be is, did you go into PT because it was a passion and hips? You're like, I love hips. And so I'm going to be like hips are my passion and that's what I want to
Yeah.
do. Like, what do you have to say about that kind of topic?
Mhm. Yeah. I think so. On the first part, on the PT side of things, I think for me, it was a matter of I knew I wanted to be in healthcare and I just didn't really know yet which part of healthcare. I like the primary care side of things.
Yeah.
My wife will tell you that, going into medicine is probably still a bit of a soft spot for me, but I also like working with a bunch of the docs. And I always say that I make your outcomes look better. But I think for me, it was just the whole passion around, you know, playing a lot of sport, having a family that was engaged in a lot of sport and that just loving the human body. And maybe it's ego. I like to say it was just attention, but my wife says it's my ego. But like, I always was excited to like assess some random thing at like at a holiday party or a
Okay.
family party, which is why I'm really good now at saying like, yeah, just put ice on it. It's fine. That's what my uncles would tell you. So I think the PT side was interested in it. I think I could have been swayed in different directions, but it was just
Mhm.
sort of that kin background that made me want to go
Yeah.
into what I thought was the challenge because there was nothing really quick. It's not like I could hook a human body up to like to some computer which would tell me what was wrong with it. Maybe in 10 years from now that might happen, but it'll never replace me. On the hip side of things, similar to you, it totally fell on my lap. So I went from my first clinic and, could this guy grow a clinic? Passed that test. And then we acquired a clinic at PTL that didn't do well. So could you go in and fix that clinic? And then I was capable of doing that. There's a little bit of luck there for sure. But the third one was, hey, we got this really cool opportunity and there's a group of physicians that wants to work with us. Do you want to start the practice? So I was like, sure, why not? Like for me in my brain, I was like, oh my God, I can learn from 5 orthopedic surgeons. I wasn't running the business side of it. It was just at that time, can I actually get better clinically? And there was one guy and he was super young. And I still remember it was Dr. Ivan Wong. And Ivan and I still do some work together when we can. And I remember him looking at me. I scope hips. And I was like, what the hell is that? What do you mean? Like, it's not arthritis? Like, what do you do? He's like, yeah, no, I do sports ortho. And then another colleague, which is Dr. Femi Ayeni, who's another brilliant doc. He's like, yeah, so you see hip scopes? I'm like, I don't even know what you guys are talking. So, and Natasha, you'll love this. Like, I remember one day they were both super engaged. At this time, none of us had kids yet either. So we were all like young and excited. He's like, write the protocol. And I was like, I don't even know what you do. And back then, before at McMaster, they actually had the right table. In the general, they used to have a huge bolster between in the pelvis. So all these
Okay.
patients would come to me. They're like, I can't feel my perineum, but they would say, I can't feel my vagina. But like,
Yeah.
oh shit. I don't know why you can't feel your vagina. And then like their husband's standing there. They're like, my wife can't feel her vagina. I was like, oh shit. What? Does anybody have a shoulder problem? Like, so anyways, the best part of this whole thing though is one day Dr. Wong literally came down from his clinic and he says, show me what you do with hips. I was like, okay. So what do I know about hips from PT school? Long leg traction. And he's like, oh, that's useless. What the hell is that? He said, oh, this is when we separate the hip. And he's looking at me. He's like, really? Like, and he's such a nice guy, but he also is no bullshit. He's like, so do you think you just separate that hip? I was like, yeah, we create space. He's like, that patient I sent you yesterday? Yeah. He's like, I put 100 Newtons of force to actually sublux her hip. Do you put that much force through the hip? And I was like, ooh, maybe it's neurophysiological. The replay, yeah. She's like, so then I go, okay, what else is, and I'm on the spot. I'm like, fuck, what else do I know? And I'm like, oh, mobilization with movement. I'm going to drive some internal rotation. So I tell him that I'm going to distract your hip. So I put a belt around his hip. I've got my hot pack in there. So I
Mhm.
got some good cushion. He's like, don't ever do that again. that was one of my
I am
first
dying right
interactions.
now. This is
And
amazing.
Ivan was like, "Oh boy, we got a lot of work to do." I was like, "I'm cool. I'm in." And Dr. Andy just kind of went with the flow, but that is literally how I started. And at the time, there was nobody doing HIP, right? So I was
Mhm.
like still quite involved on the clinical side. I just finished doing my fellowship. So I was like, yeah, I want to create some education and some awareness around a joint that not everybody was doing. They want to be the knee, they didn't want to be the shoulder,
Mhm.
and everybody wanted to be a spine person, right? So I was like, I'm gonna be the hip guy. And then because of the hip guy, I met the neurosurgeon. So then I became the spine guy again. But that's literally how the hip came about. So don't pull an orthopedic surgeon's leg and say you're doing long leg traction and I'm separating the joint. Just go with neurophysiological response.
Oh my gosh, I love it.
So that's it. And here we are, book chapter later with those guys, tons of publications. And that's the cool part that I would say. Just don't say no to stuff. Like
Yes.
if I didn't do that, I would have shied away to be like, oh, I don't do this. Never would I have been presented to these guys. And it's
Well, and
been
I
fun.
think it's that whole thing too of we're never gonna be 100% ready,
No.
like, ever. Like, I think about it, so, like, I leave for Spain in a week and a half to present at the World Orthopedic Conference on concussion, which, like,
Amazing.
that conference, when you look at the talk, it's all surgical shit that I have no idea what they're talking, like, no clue, no clue.
Yeah.
Am I nervous? 1 gazillion percent.
Mhm.
Could I have said no? And did I actually consider saying no? I 100% did. And then it was like,
Mhm.
give myself a shake because again, we're never going to be 100% ready. And when these opportunities present itself, and it's that like, I don't need to be perfect. Neither of us were perfect. My
No,
first concussion, I
far.
freaking looked right at her and I sat there and I looked at her and I said, I don't know what to do.
Yeah.
And she's like, and I was like, but I'm willing to learn. And at
Mhm.
that point, I literally like dialed up a colleague of mine that was a vestibular therapist and said, "What the do I do?" And she's like,
Mhm.
"Well, you could do this." And then you could look at her eyes and we're like, oh my God, it was bad.
Mhm.
But again, like she stuck with me, like thank gosh to her. But then that opportunity of doing something that was uncomfortable that we didn't think we were
Mhm.
ready for,
Yeah.
then spills into something else and then spills into something
Yeah.
else.
Mhm.
And we have to be as a new grad too, like, you don't know anything as a new grad. Like, to the new grads that are out there, if you are listening to this, we adore you and you don't know anything.
Yeah. And I don't like fake it till you make it bullshit. Like
Oh, I
that
hate
is
that with
the
a passion.
worst advice I ever
Yeah,
got. Right.
yeah.
And I think the important part is we have to remember like it actually is called practice for a reason. Right. And I think even if you ask a lot of like, experienced clinicians who people know in our space, they'll actually tell you like, and Jim Millard told me this all the time. I reinvented myself every 5 years
Mhm.
because you kind of go through a learning journey and things change. The good clinicians evolve with that change, but almost start again as new grads.
Yeah.
Oh my God. Because now you're kind of playing off what we used to do versus what we now need to do. But things in the past work. So why would I switch? Well, guess what? Things evolve, things change. Right.
Yeah.
And I also don't like, I had some dipshit tell me recently. He's like, well, it doesn't really matter what you do because people get better on their own. I was like, listen,
Mm.
that is not. People need coaching. They need good advice. They need good direction. There was a study that CPA did, the Canadian Physio Association, where they actually interviewed patients that have all attended physio. And they asked, what do you see as your physio? Besides us being like primary care, coach, cheerleader, motivator, like that stuff is relevant.
It's
So
real.
maybe what I didn't do before, because my skill sets evolved, didn't mean that I still wasn't there to support that person to help them along their healing journey. I wish I knew what I did now
Mhm.
because all those people that I kind of fell off wouldn't have probably fallen off. But it's really interesting. But that whole thing, fake it till you make it, doesn't work.
It's terrible.
People don't get better on their own. They need guidance.
Yeah. We're gonna do one more question because again, like we could just talk
Yep.
forever. I always talk about like the things PT school didn't teach us that are actually
Mhm.
the most important things in private practice. Well, in practice in general,
Yeah.
not even just private practice.
Mhm.
What would you say? I'm pretty sure I know where your answer is going to go with this one. But what is one of the most important things that we get maybe shown in PT school, but not coached through enough as one of the most important skill sets you can have as a clinician?
Okay. You'll know my answer, but it's 100%. right? And I think people that don't focus on being able to connect with patients, they get really frustrated and upset. And they think it's because it's too businessy. Like the business acumen of being successful at practice, because I like what you said, it's not only private, it's also public. Like
Mhm.
if you don't know how you're funded in the healthcare system, that's why we get blown up in departments because people don't know what we do and we don't know how to advocate for our expertise. But it seems to be that it's more sort of the focus, if you will, in private sector. But in order to be successful, yes, you do need business acumen. But if you were really good on the communication side, and that was emphasized, and the other thing too, where I kind of merge this whole connection piece is treating a patient or treating a condition is actually really great if you know you're and you have good mentors. But treating people is very hard and it's complex. And you got to get your head out of your ass because you can't do that by yourself. This is why,
Mhm.
using technology, having an interdisciplinary model of care, understanding that don't tell me you're evidence based, but you don't look at things from a psychosocial perspective. That's what causes people to feel like they don't bring value to patients or their clients because you're trying to work in a silo and you're only really addressing a biomechanical factor when maybe you actually need to tap the shoulder of a counselor, a psychotherapist, a psychologist, a social worker. Like that's how you manage people.
I'm going to take
And you
that
need to
one
learn how
step
to
further
manage people.
too.
Yeah, go for it.
When all you do, so all of that for sure. And then taking it one step further of like when all you do is manage the biomechanical
Hmm.
or the condition, that is when clients don't feel seen, heard, and validated.
Yes.
Because in order to feel seen, heard, and validated, you need to recognize the
Hmm.
entire aspect of their life. And if we're not doing that and we're not asking and again, exactly like you said, you don't have to be the person to know how to support it. But this is
Hmm.
why referral networks are so important because
Yeah.
if you do ask the question, you should have somewhere to ask them for support if something does come up.
Right. I think there's a fear, right? Especially in your world, this
100%.
concussion world, right? It's like, oh my God, I can't diagnose concussion. Oh my goodness. If I've identified that someone has anxiety and depression, I can't treat depression. No, you can't. But people can. But it doesn't mean I shouldn't be able to identify it and learn how
Exactly.
to actually address that with the patient. Say, hey, this is something that I found. Would you be interested in learning who could maybe support you there to
Yes.
add to your team? Right? It's the patient's team. It's not my team,
Yeah.
right? You're going to get rejection sometimes, and you have to be comfortable understanding that patient can say no. But then are you comfortable enough where I would say to you, hey, Tasha, here's the repercussions though, if you maybe elect to go a different way. That's all I have to tell you. I'm not going to be like, well, if you don't do that, you're not going to get better. I don't know.
Yeah. Well, and it's that
But you
second
would.
piece of two, potentially they're not and this is run into this all the time in my world.
Mhm.
You bring it up, they're not ready for it.
Yes.
You've planted a seed. You don't
Mhm.
have to harp on it. You don't have to stick to it. But when a discussion comes up in a future session that kind of comes back to that, you can come back to it again and say, "Hey, have you given any more thought to what we talked about in connecting with a therapist?"
Yeah.
Because you can't force someone to do anything, but by planting a seed and showing that you care and building that communication and that rapport, that client feels more seen, heard, and validated in your
Yeah.
presence than they probably have in many people's presence in their journey.
Yeah. And I love how you said like heard, seen, and validated. You say it so fast, right? And it's great. Like everybody has to learn that because when we go to, an individual client, right, or a patient, and the therapist is like, I don't know why they fell off. I must not have been good enough. It had nothing to do with that. You either didn't meet expectations, they didn't feel heard, you didn't validate their issues, or to be honest, maybe you forgot to tell them they were supposed to come back. So like, it's not that often that they think you suck. And even I
Mhm.
have this, clinician right now, we had to have a conversation. I was like, I don't know what else I can tell you other than you need to make yourself more vulnerable, create a safe space because this environment right now is too cold. Clinically, you're actually doing everything that I think you should do, but the patient doesn't feel the value because they don't feel heard, seen, and validated. It's just the way that you're approaching it. Are you
Yeah.
willing to actually work together on? Let's just start
Yeah.
with setting expectations. Okay, I can do that. Okay. But why, to your point back in PT school, for example, like there's a million things PT school should have spent more time on, but it's a 2-year credit is what it is.
Yeah.
We just published a paper that shows there's close to another 100 competencies we should learn from a business and practice management side of things, but no one's going to entertain it because they're like, where do we put this in the curriculum? But
Yeah.
reality is this was identified as extremely important information for us to be able to know, right? But I think that's the whole premise of practice and why you really need good mentors. But I'll sort of share with you something else as well that comes with sort of that being uncomfortable. But
Mhm.
again, that's sort of development, right? Like if you stay where you're comfortable, you're never going to evolve, right? So if you want to advance in your career, you have to be uncomfortable at times and stay curious and ask questions. Don't worry about is something to think I'm stupid. You got to let that go. You're kind of stupid if you ever don't feel uncomfortable. You don't feel a safe environment to ask questions. But I remember after I was sort of figuring out the whole hip world, I had another doc and a business owner approach me to say, I need you to set up a program here. I need this clinic to make more. I was like, okay, how
All
hard can
right.
that be? I'm usually pretty good at it. So I went in there and I was like, okay, man, like, don't worry. I'm going to drive into Toronto. This is before the traffic got crazy. Now you don't want to drive to Toronto. So, but I would literally go for 14 hours. And I even had physio students that would come with me. And this is the caveat of where this all evolved. So this orthopedic surgeon, it was Danny Will at the time. We're building this program. I'm like, Danny, send me every one of your hips. We'll fix them up. That was the wrong word. I should never have said fix. But in communication with an orthopedic surgeon, we had to talk about fix it. And so he did. So anybody he wasn't going to operate on or he didn't want to operate on, he's like, go see Darryl. And I was like, okay. So I'm like, I don't know shit, but I'm making it look like I'm doing shit and we built them a protocol. And then we got some people better and they still follow me now. And I'm like, oh my God, this is awesome. And then I had a huge patient population that I could not help. I was like, what the hell? Like, this is weird. Why can I help them and I can't help this other group? So I didn't look for a new modality that I missed. I didn't take another course anymore. And I happened at that time, I had Brittany Van Dyken was my physio student from back. Her mom is Carolyn Van Dyken. She was one of the most known pelvic health PTs internationally. I was like, Britt, what the hell is wrong with these patients? Like, why are they not getting better? And she's like, I think maybe it's the pelvic health component. I was like, oh yeah, like the pelvic floor muscles? Yeah, maybe it is. So clearly she dealt with, my naivety to that at the time. So then I was like, maybe she's right. So I found a pelvic health PT that I knew from my orthopedic programs. And I said, hey, I'm going to do a pilot. I'm going to send you all of these young female patients that are coming here with labral tears that I don't know how to fix, right? Like I can't help. And, as I learned more, all of a sudden, well, there's a lot more pain science components, more awareness of the psychosocial components because of how this particular clinician was trained. And I wasn't doing any of that. I was ortho trained. I was a
You're
mid
ortho,
therapist.
If
I could immobilize or manipulate, it wasn't a problem, right? But it's okay. This is again why
he was young Darryl learning his
this
lesson.
was young Darryl just trying to see how big his ego could get, right? So, but then I said to Brittany, I was like, we need a screening tool because I don't even know what you're talking about. So she gave me a screening tool and I was like, oh, this is pretty cool. I'm like, oh my God, I don't even know what half these words are. Like, are these conditions? Are these, I don't know. What is dyspareunia? I was like, I couldn't even say the word. But it's like, now I know what they mean. But I said to Britt, I'm like, can you dumb this down for me? Like, let's create a tool for me, the orthopedic physio. So Britt, actually, that was her project. So we did that and we ended up publishing. So we created a tool. And just when you think you have a tool, then you have to learn how to use it. So what I would do is I would say, hey, Natasha, I've got good news for you. Yeah, your labrum's torn, but on this tool here, you should go see a pelvic health PT. And they're like, okay. But I didn't tell them it was going to be an internal exam. Oh, so I didn't know how to apply it. So anyways, long story short is eventually I learned how to communicate to patients that this may be a contributing factor. This person may be doing interdigital palpation. And if you were concerned about that, we created an app and you just say, hey, why don't we just do a discovery call? And that therapist with the expertise could support and assist. And all of a sudden, that transfer of care became much more common.
I love that.
But it was so interesting. That's how we got into the pelvic health space, because I'm like, why can't I help these people? Who
Hmm.
else can help these people? Holy shit, I don't know anything about this world. And I was kind of almost doing a bit of a disservice. And then I had to use and took a student, God forbid, take goddamn students. And that student was the one that leveraged me into actually helping more people than I could have by myself.
That's awesome. Like, and it just, again, we are always learning, always.
Mhm.
And things are always evolving and always changing. I got a message on Instagram yesterday because that's how I talk to most of the people in the
Mhm.
world.
Yeah.
And she's on a healing journey. She's an amazing woman. But she was saying to me, she's like, do you feel like there's a place for therapists in this concussion space? Because she's been told from her concussion team that there's no evidence to support it. And I almost had a heart attack to begin with. And I just said to her, I was like, there is a reason we have a trauma therapist on my clinic team.
Oh, yeah.
Like, yes, 1,000,000 and gajillion %, whether there's a peer-reviewed study saying that it's necessary, there is a place. Yes. And
Yeah.
again, I think our clients are our biggest teachers, right? Like, especially when like you see a ton of hips, so you get to see trends, right? And so same with me, like all I see at this point is concussion, acute and persistent, and some FND. And so when I start noticing trends, then it's like, okay, now what am I going to do about this? And I always say to the clinicians that I mentor too, you do not, you're not going to know what everything means when you first start seeing it, but just document it. Just make
Mhm.
note of what you're seeing and what you're observing, and then we can talk about it. And when you start seeing the same thing over and over again in a particular group, like that's something to take note of.
Yeah.
And
Yeah.
then kind of you can dig into from there. Like, and
Mhm.
so, yeah,
Yeah.
you should exactly
And
what you did.
and we call that, like, I love that. Like, that's your kind of learning journey, right? I think the problem
Mhm.
too in PD school, we're like, oh, look for clinical patterns. So we're actually trying to look for clinical patterns based on what we learn in a textbook. But it's the people that you have to be able to understand. So you have this learning journey, but then, on our coaching side, where we're working with a lot of clinicians in our programs, it's like there's also an unlearning journey. There's things that you learned in
Yes.
PT school that
Yes.
taught you basic competence, but you don't have to
Yeah,
do this in every case, right? So
so
you
true.
have to also document things and work with your mentor. So you and I can sit down and say, hey, you know what? I'm really glad you documented that. Which sort of, group of findings helped you get to your conclusion? And which things did you do that really didn't give you any info? Do you now understand why? So you can start to eliminate that, because I don't know. I don't think I learned 8 special tests for the ACL and I don't use any now. Like,
Yeah.
if it's just something that we do, but we don't always have to clinical
Mhm.
practice.
Let's switch it because I'm like 30
Yeah.
minutes is out the window. So we're going to go a few more minutes here. Let's quickly hit on the topic of a mentor because you've mentioned it. I've mentioned it. We are both that within our specialties in our profession. And yet, again, I feel like this is an area that doesn't get enough attention and the power of mentorship. And so I always say to me, you can take a zillion courses under your belt. Go for it. But to me, and in my own experience and my own growth in my niche, having a mentor is like the fuel to the rocket ship,
Mhm.
and it will accelerate your learning faster than many other opportunities. So when you think of mentorship and when you mentor, what would you say the value mentorship has been in your career growth
Mm.
today?
I would say 2 things come to mind is, one is accountability to do things, right? And the second one, and we'll kind of touch upon both, but the second one that I find is pushing you outside of your comfort zone, right? Like, try this. And I still remember, like, the first time I was supposed to be in, like, C1 and C2, I was like, there's no way. But then your mentor's like, do it now. But but I also think too, it's that part on the acceleration side, whether it's because we called our company Clinic Accelerator or not, but it's so true, is like, and I say this to everyone that I now mentors, because this is how I was mentored. What took that person maybe a decade to figure out, they're going to fast track that for me in a year or two.
Yeah.
Right. And I always say to people is, my job is not just to, pass on to you my successes, right? My most important skill set, and this is what people did to me, I was very fortunate. I'm going to pass on to you my failure. do not make the same bloody mistake that I did. Make your own, right? But
Mhm.
making your own mistakes is going to as well help you develop a career. But I want you to skip over the ones that I make, because we say to people on a regular basis, we made like millions of dollars in mistakes. Don't do that, right? Make different ones, right? Because you
Yeah.
can't learn if you don't learn
So true.
from your mistakes. But that's the other thing too that my mentors did is I did things and they helped me realize that there was a learning component out of that mistake. Stop beating yourself up because shit happened. No one died. You didn't do anything wrong. Don't sleep with patients. Like that's pretty clear that happens, but just, we're not talking at that level, right? We're
Yeah.
talking about things of like mistakes and learn from those mistakes. That was my best mentor. And then making sure that I still remember, like I can tell you exactly where I was in the clinic. I remember doing needles and I was just afraid to use acne. And I remember this physio came in beside me. He's like, I want to watch you needle, but I just paid for it, of course. It's like, oh, okay. And I'm like trying to tap the needle. He's like, like in the guide tube and I can't quite
Uh-huh.
get it. And he's like, boom, he flicks it. He's like, stick it in the, and I remember GB30, I swear to God, like I'll never forget. But after that, like I realized that you learn this new skill and you have no, applied learning afterwards.
Yeah.
Same thing we see when we teach people. It's like, yeah, we're going to teach you how to treatment plan properly. Oh, I treatment plan. No, you don't. Like you got to learn to apply the theory and the concept afterward because that's what makes you successful. So I think for me, it's accountability to do things, hence the applied learning piece, pushing
Mhm.
outside your comfort zone. Appreciate the fact that a mentor's going to accelerate your development because they're going to help you get to different mistakes that you're going to learn from faster.
I love that. And what a beautiful tie it in a red bow end moment for this interview.
Thanks for having me. It's
So
actually
much.
fun.
I was like, again, I just hit record when we started because
Yeah.
who knows where I was going to go. I am honored that you're part of the summit. Thank you for coming.
Mhm.
For those that are listening, again, Darryl will have his talk. He's also part of the live panel for the business panel for the clinicians as well. So you'll get to learn more from him there. Thank you for all you do and for being such a support to my mission and what I do as well. So I appreciate you.
Mhm. Yeah, I appreciate you too as well, Natasha. And we'll
Okay.
see you guys all at the summit in September.
Yeah. All right, team. Jump below, grab the link, register if you haven't registered. There are free and VIP passes, whether you are on a healing journey or a clinician wanting to have an introduction to a more holistic approach to concussion rehabilitation and get some valuable learning. Until next week, have a lovely day. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.